Get set. All right, so good morning.
Good morning.
And we ask your legal permission to talk to you all this morning about your previous surgery. You both had lap bands.
Yes.
And yesterday you went through the wacky mini gastric bypass.
Yes.
Good. And so maybe a first name introduction, and you want to tell us about your lap band for a minute and about your surgery.
Sure. I'm Jamie. I had the lap band 8 years ago in an attempt to try and take off quite a lot of weight, and it was also 40 pounds ago. So it clearly did not work for me. I didn't have any physical problems with it so much, just a great frustration that I'd gone through all that, and it was a very big disappointment. Thought I was doing something good for myself. And now I feel like I'm really on the right track. I'm very grateful to find someone who would do this, not only perform the MGB, but reverse the lap band all in one. It's just a great feeling.
And your surgery, I think we said, took 65 minutes yesterday.
Right.
And roughly, just to let you know, that took about 30 minutes to get the lap band out, the scar tissue and all that, and kind of, I like this, I don't know if it's the right edge to, but kind of dig it out because it's stuck in there. And
Yeah.
you take our little tiny scissors and you kind of nibble at the little scar, and then you cut through it and then take it out. And but it all went smoothly. The anesthesia went great yesterday. And one of our other lap band patients has talked about right after the surgery he started drinking or eating. Can you tell the difference?
Yeah. You don't feel that restriction.
Right.
Just don't feel it. It's really a release
Good. Okay.
of a type of a feeling.
All right. Good. And let's see. Then from Louisiana.
Yes, my name's Laura. I had my lap band in 2003, similar reasons. I didn't really have too many problems with the band. I got pregnant not long after that. I only lost about 20 pounds, and that was probably from the surgery itself. And I got pregnant, and of course I couldn't get it filled, and so I never really got an opportunity to use it much, but I was pretty much hungry all the time when I didn't use it. And then I had the baby and I was about to go get it filled, and I had a car accident, and my band slipped up around the bottom of my esophagus, and that was last September. And ever since then I've just hardly been able to eat. I choke, I vomit, and I'm starving all the time because the only foods that really get down in there are maybe a milkshake, and if I'm lucky, sometimes I even have trouble with that. I eat milkshake, ice cream, yogurts, things that are thin. If I try to eat something, bread, I tried to eat an orange one time, it's very painful. And so yesterday, between my back and my lap band, I was in more pain than I am today. I was able to eat today, I'm not hungry, and I don't feel it at all.
So let me touch on that, because now we claim that when you cut through the stomach and cut through the vagus nerve, that there's going to be decrease in that serum hunger hormone ghrelin. Does it feel like that's happening today? Do you feel
I didn't
different?
feel hungry at all. In the lap band, I was always hungry.
Always hungry.
Always hungry, and that was so confusing and disappointing.
I remember I had a C-section in just about 16 months ago, and I had a lot of trouble with gas, and it was a major surgery, and I was starving, and that was almost worse than any of the gas pain.
Because you felt hunger.
Eat,
Yeah.
and I haven't had any of that.
And so what we think, and again, I think this is fairly good science now, is that studies of lap band patients shows that their hunger hormone ghrelin does not go down. In fact, in some people may actually go up. So that you want to eat, you have the desire to eat, but oftentimes the band itself blocks, not all foods, but some foods. So steak and lobster?
Oh, never.
No, right. That's not going
Maybe
to
little bitty bits if I chewed
Maybe.
it up really fine for the lobster.
Now, what I've heard from the critics who are favoring the lap band, they say a lap band's going to work, it's just your responsibility to use it better. Are you guys just not very good people, and that's why the band didn't work in you?
Well, I don't think so.
Have you heard that? I mean, have you
Yeah.
heard that?
That's what my surgeon said, because the stomach fills from the top. That's going to keep me from feeling hungry.
Right.
But it just didn't
No.
happen.
I was starving. The day after my lap band surgery, I was starving. I was hungry.
I was too.
And I was eating about what I'm eating
Right.
today, the chicken broth. And I didn't have any yogurt until just a little while ago. And the morning that I woke up from the lap band surgery, I was hard.
I remember getting Jell-O and fruit juice, and I was hoping it would prevent that hunger from coming, but it's that burning hunger you get from that sugar. And I was hungry before I ever left the hospital. Well, the second day.
Yeah. And this today, let me
I
see if I got it
feel
right,
full.
not so much today.
Not at all today.
I had to kind of make myself eat the
Yes.
cracker because I want to make sure I got the sodium.
Yeah. Well, good.